So you just add unprotected sex or unplanned sex, and hey, you're worried. What's the next line of action, and what will you do? Relax. Relax, you're in the right place. And that is why you're watching this video. I am going to be teaching you exactly what you are going to do next. Just take a seat and watch this video till the end. So you're welcome to my channel. My name is Jane. I am a registered nurse and a registered midwife. So this morning, we'll be talking about unprotected sex and next line of action. What is unprotected sex? It is a kind of sex you have that you didn't plan for, an unplanned sexual intercourse that you did not bargain for, you didn't plan, and you didn't use protection during the sexual act. So what is your next line of action? When you have unprotected sex, there are two things that should be coming to your mind. The first thing is unwanted pregnancy. Yes. And the second thing is sexually transmitted infection. So, we will first of all start with unwanted pregnancy. So when you have unprotected sex, even if it is just once, you have a high chance of getting pregnant. And this kind of pregnancy, if it's not planned and you don't know, you are not ready to cater for that child, it is called unwanted pregnancy. So the next thing for you to do is, if it is still within the first 72 hours, you can get yourself emergency contraceptive pill, which is also known as Plan B. There are different types of emergency contraceptive pills. The most common one that you all know is the Postinol 2. And I hope we all understand that this should be taken within 72 hours of sexual acts. Because I've had several people come to meet me and they will be like, how come they still got pregnant after using emergency contraceptive pill, after using Postinol 2, they still got pregnant? Yes, you got pregnant because you did not use it correctly. You did not use it in an ideal way, the way you were supposed to use it. It should be taken in early hours of sexual intercourse. Yes, and I want you to understand that Postinol 2 will not terminate already formed baby. It will not abort the pregnancy. It will only help to prevent pregnancy and babies that have not been formed. So, there are two stages of actions you should take. The first thing is be easy on yourself. Don't beat yourself up. Yes, you can't keep dwelling on the mistake. It has happened. You move on. The next thing is immediate action. How you're going to prevent the pregnancy. You immediately should take a calm shower that will calm your nerves and you'll be easy on yourself. Then you take your next available speed to the closest pharmacy near you, where you would be able to get your over-the-counter emergency contraceptive pill. There are a lot of them. Some are levonorgestrel, and an example of that is popularly known as Postinol 2. You can use that. It prevents pregnancy. Then another thing you can do, if it is still within the first 5 days, you can get your IUD insertion, which is known as intrauterine device, which helps to prevent the flow of sperm into the uterus, and hence it disturbs the formation of fetus, which is known as the baby. So if we are clear on that, and you should know that after 2 to 3 weeks, you should try to get your pregnancy test done to check yourself if you're pregnant. If the result is negative after 6 weeks, you should do the check again to be sure you're on the safe side. So the other aspect is, if you are feeling concerned or worried about sexually transmitted infection, the first thing you're supposed to do is, immediately you notice you've had unprotected sex, is to use the bathroom. Yes, use the bathroom. Take a cool bath that is going to calm your nerves, and when you are taking your bath, ensure you urinate. Yes, pee if you are pressed. Urinate and pee. It is good for you. Then secondly, wash your private parts. I do not mean inside your private part. I do not mean inside your vagina. I mean wash the private part, the labia. Yes, you part and you wash with cool water or mouth soap. The mouth soap you normally use when bathing. After washing, make sure and ensure you take enough water. It is important. Yes, hydrate. It helps to flush out the toxin in the body. Yes, when you hydrate, it flushes out the bacteria or the toxins in the body because it prompts you to urinate more. Then aside that, the next thing you're supposed to do is to book an appointment with your doctor. You know why? So that within the first 48 hours, like early hours of exposure, you are supposed to take a post-exposure prophylaxis if you suspect that your partner may have sexually transmitted diseases or infection, which may include herpes, HIV, and hepatitis. So, that post-exposure prophylaxis will only work for viral infection. It prevents it. So another aspect is your doctor will be able to follow up on your case medically. And if they are still going to run some laboratory investigations on you to discover if you have not contacted any other bacterial infection. So I think with all this, your mind should be at rest. You should work with your health professional. They will be able to schedule you for further tests if you still need to be monitored. For a case of sexually transmitted infection like HIV, 6 months after exposure, you are still supposed to still carry out the test to be sure that you're on the safe side and to be sure that your post-exposure prophylaxis that you took was effective while you were taking them. So I think that will be all for now. If you have any question, any comments, please comment below. I'll be glad to attend to your questions. Yes, and that will be all. Kindly like, comment, and subscribe. Thank you for watching and see you next time. Bye.